Hey everybody, Luke Gordon, physical therapist here, and I'm back with another video on shoulder pain. Got my model here, and this time we're talking about what is the rotator cuff. I was looking back through all of my videos I have on shoulder pain, a lot of different videos on certain types of rotator cuff issues, supraspinatus, infraspinatus, all these things. And a long time ago, I had a video on what the rotator cuff is and what causes shoulder pain. But it turns out no one's watching that video. I think largely because it was so dark and probably the sound quality is crappy as well. So I thought I would kind of go back to the beginning and just talk to you about what is the rotator cuff. And also, towards the end of the video, I'll talk to you about why is it so commonly causing pain for people, and what does it look like? If you think you have rotator cuff pain, what does it look like? So let's dive into just the beginning again. What is the rotator cuff? So a lot of people misuse that term, or they just don't understand it, call it rotator cup, different things, or a rotary cup. I've heard all sorts of fun, inaccurate names over the years for it. But the rotator cuff is 4 small muscles surrounding your shoulder. So this is a right shoulder here I've got in my hand. This is facing out towards you, so it would sit on me like this. Got my shoulder blade in the back, my arm coming down here, my humerus, my scapula, my clavicle in the front here, my collarbone. And then the rotator cuff basically is these 4 small muscles that sit underneath your bigger muscles. So it's easy to identify like bigger muscles like your deltoid here, triceps, biceps. They're not real big on me, but they're big on some people. Upper traps here. Below those are 4 small muscles that are stabilizing your shoulder joint. Those are your rotator cuff muscles. So you've got supraspinatus along the top, infraspinatus, teres minor, and then subscap sits in the front. Kind of a weird spot. It sits on the front of your shoulder blade, between your shoulder blade and your ribs. You don't necessarily need to know all those muscles, but basically what I want to emphasize in today's video is that those 4 muscles make up your rotator cuff, and their primary role is to stabilize your shoulder joint. If you look at your main joint in your shoulder, which is where you get all your motion, you get 6 planes of motion, you can reach forward and back, you can reach side to side, and you can rotate it in 2 different, different motions there. So the reason you have so much flexibility in your shoulder is that it's a really shallow socket with a relatively large ball. So you can't really tell on the model here because the ligaments are in the way. But if you can imagine like a golf ball sitting on a tee, shallow socket, large ball. It's basically the opposite of your hip. So the hip is also a ball and socket, but with your hip, that ball fits into a deep socket. So you still get quite a bit of motion in your hip, but it's very stable because the socket is so deep. So again, back to the shoulder, shallow socket, large ball, makes it really easy for your shoulder to just not be stable. So that's where your rotator cuff comes in. When you're doing these motions where you're reaching, you're throwing a ball, just the constant day-to-day motion of your shoulder to use your hand, your rotator cuff muscle is always keeping that ball in good proximity with the socket. Essentially what you don't want is you don't want the ball rolling out of the socket. That would be extreme. That would be a dislocation. But not so extreme is when the ball starts to ride up in the socket, and right above the ball, sitting between the ball and basically the top of your acromion here, which is part of your scapula, is your top rotator cuff muscle. That's your supraspinatus. For the average person, when we talk about causing shoulder pain and rotator cuff issues, the supraspinatus is the biggest culprit. So I've got videos on supraspinatus, tendinosis, things like that. I'll pop one above here after I go and edit the video here. But supraspinatus is the most common culprit. If you've had an MRI, you might see supraspinatus tendinosis, which again is in that video I just popped up. Different things, different tears in the supraspinatus. And basically how that happens is that eventually, for most people, you get that ball riding up and impinging that supraspinatus muscle. That's your most common type of rotator cuff pain or shoulder pain, is that ball is just pinching that tendon over time. You tend to get pain along the outside of your shoulder. So just going back again, the rotator cuff is there to stabilize your shoulder. Unfortunately, it's also really easy to irritate the rotator cuff just based on the anatomy and the inherent instability of the joint, meaning that ball just doesn't have a lot of bony stability because the socket is so shallow. So that's your rotator cuff in a nutshell. That's why rotator cuff pain is so common, because as this top supraspinatus muscle is trying to maintain that space between itself and the 2 bones, trying to create some space for itself, oftentimes it's getting pinched in the process. And essentially what happens for people with rotator cuff issues too is that it's just a balancing act. The healing is not good with the rotator cuff. I've talked about this in other videos as well, but you don't have a whole lot of healing power with the rotator cuff. The blood supply is poor. And then what happens too is most folks, when they get shoulder pain, their automatic instinct is to relax the shoulder, to rest the shoulder. And over time, that just makes the rotator cuff muscle even weaker. As the muscle gets weaker, it's getting pinched even more, damaging even more. So it's really a nasty little cycle. That's where most physical therapy will come in to help you break that cycle, or working with someone who specializes in helping you with shoulder pain. So it's very treatable, so that's good. So again, I hope that just gives you a nice overview of the rotator cuff, what it is, and then in my other videos I've got tons of stuff on how to treat it, how to diagnose it, what do all the terms mean and stuff like that. So I'll link a couple at the end of this video, and then if you have questions, as always, leave a comment below and I'll do my best to get back to you. Thank you for watching. I appreciate it. Give me a thumbs up if you would before you go, and don't forget to subscribe to the channel. That's it for now. Thank you.